We often talk about those really big operations, the ones that are kind of hidden in plain sight. They're so massive, but we don't really think about them that much.
Yeah, I know exactly what you mean, like the systems that keep things running smoothly.
Right, exactly. And healthcare is a perfect example of that. Like, have you ever heard of Cardinal Health?
Oh, yeah, of course. They're a pretty big deal, actually, a Fortune 15 company.
Exactly, headquartered in Dublin, Ohio.
And they play this huge role in getting medical supplies and pharmaceuticals where they need to be, but most people don't even realize it.
That's exactly why we're doing this deep dive today. We're going to uncover the story of Cardinal Health, this business behind healthcare, so to speak.
And I think what's really fascinating is as we explore their journey, we'll see how closely it's mirrored the changes in healthcare as a whole. Starting small back in 1971, and now they're exploring these cutting-edge innovations like drone delivery and digital health solutions.
It's a pretty remarkable trajectory when you think about it. From this humble food wholesaler in Ohio to a company that impacts caregivers and ultimately all of us as patients.
For sure. So, where do we even begin with a story this big?
Well, let's rewind all the way back to the 1970s in Ohio. Yeah, that's where it all started.
Okay. So back in 1971, there was this young guy, Robert D. Walter, a recent Harvard Business School grad, brimming with ambition, and he saw potential in this struggling food wholesaler called Monarch Foods.
Yeah, and he really took a leap of faith, didn't he?
Oh, yeah. He and a handful of investors managed to scrape together $135,000 in cash and took on a mountain of debt over $1.3 million to buy this company.
Talk about a risk. They renamed it Cardinal Foods after Ohio State bird.
Yeah.
But here's the thing. Walter actually believed that not knowing the ins and outs of the grocery business gave him an edge.
That's so interesting. Sometimes not being bogged down by conventional wisdom can be a real asset. It allows for more creative solutions and adaptability. And it seemed to work for him. Look at the results. Within a decade, they managed to grow sales tenfold, hitting almost $200 million in a very competitive market.
That's incredible growth.
Mm-hmm.
But then the late 70s hit and things got tough, right?
Yeah, you had this huge consolidation happening in the food industry. Smaller distributors were feeling the squeeze, plus Cardinal even had to deal with a salmonella outbreak.
Oh, wow. That must have been a real setback.
It was a defining moment, actually. Instead of just trying to stay afloat in a struggling industry, Walter had this realization Cardinal's strength wasn't necessarily food itself.
Yeah.
It was their ability to distribute efficiently.
Yeah, so basically their logistics were their superpower.
Exactly. And he realized that could be valuable in other sectors too. And that's when he set his sights on the booming pharmaceutical industry.
It was a strategic pivot that would change everything.
Oh, absolutely.
Yeah.
So in 1979, they made a crucial acquisition. They bought Bailey Drug Company in Zanesville, Ohio for $4.4 million. That was their official entry into the world of pharmaceutical wholesaling.
And Walter's reasoning was pretty straightforward. He said, I could understand distribution and we could translate our experience with food into drugs. It sounds so simple.
It does. But the impact on the healthcare supply chain was huge. They took their expertise in logistics and applied it to something so critical, getting medications to pharmacies and hospitals reliably.
It's easy to take that for granted, but the precision and reliability needed for pharmaceuticals is a whole different ballgame compared to groceries.
You're right. And Walter recognized that by the early 80s, he made the decision to completely divest from their original grocery operations.
No.
And in 1983, they went public.
Wow, so they were all in on healthcare at that point.
Absolutely. They were fully committed.
Yeah.
And as some industry experts noted, this was the start of a quiet revolution in drug distribution. And Cardinal, even though they were still smaller than some of the big guys, they were right at the forefront.
It's amazing to think those early deliveries to local Ohio pharmacies were the very first steps in what would become this massive healthcare logistics operation.
It really is. So moving into the 1980s, this is when we see Cardinal really start to build that national distribution network. Robert Walter's strategy was all about acquisitions, and it really kicked into high gear.
Yeah, he knew that to compete at a national level, they needed to expand their footprint. And the pharmaceutical distribution industry at the time was kind of like a patchwork of regional and local wholesalers.
Right. So Walter started strategically acquiring these companies one by one, building their presence across the country.
But it wasn't just about gobbling up other businesses. Walter also had the foresight to reinvest profits into modernizing their operations. Their early adoption of computer software to manage inventory orders, deliveries, that was a game changer.
Oh, absolutely. Back then, a lot of their competitors were still using manual paper-based systems, but Cardinal was embracing technology to become more efficient. And it wasn't just about typing orders into a computer, it allowed them to track inventory in real time across all their locations.
So they were really data-driven from the start.
They were. And that gave them a huge advantage in terms of speed accuracy and cost effectiveness.
So as they acquired more distribution centers across the country, they could integrate them seamlessly into this increasingly efficient system.
Right, and that translated into better service for pharmacies and hospitals who are relying on them for timely deliveries.
We're talking about expansion into the Southeast, the Mid-Atlantic, all through strategic acquisitions throughout the late 80s.
And it wasn't just about buying up physical assets. They were smart about retaining talent from the companies they acquired. They recognized the value of local market knowledge and those established relationships.
So they were merging their own resources and systems with the expertise of these local teams.
Exactly. It was a recipe for successful integration.
Yeah.
And then in 1988, they made a really symbolic move. They completely divested from the original food distribution business.
So they were officially a pure-play healthcare company.
Yes. Their warehouses, their trucks, everything was dedicated solely to medical goods.
And their reputation for reliability was growing too. We even came across an anecdote from a pharmacist in Columbus who described their Cardinal driver as being like clockwork.
That's a great way to put it. They were becoming so integral to the daily rhythm of patient care, even if most people didn't even know their name.
So by the end of the 80s, they were this silent but essential force in the healthcare supply chain. Which brings us to the 1990s. A decade of massive expansion and diversification for Cardinal.
Yeah, the 90s were really when they took things to the next level, and prime example of that is their 1994 merger with Whitmire Distribution.
Whitmire was based in Texas, right?
Yep, and this merger catapulted Cardinal to the #3 spot in the national pharmaceutical distribution landscape. It also gave them a major foothold in the western U.S.
Plus, it added a whopping $2.25 billion to their annual sales. They were suddenly in the big leagues competing with the industry giants.
They were, but they didn't stop there. They realized they could be more than just a distributor. They could become a comprehensive healthcare solutions provider.
So they were thinking bigger picture.
Exactly, and you see this in their 1995 acquisition of Medicine Shop International. They were the biggest franchisor of independent retail pharmacies at the time.
So that gave Cardinal a direct connection to the retail pharmacy market.
It did. They were getting closer to the patient, so to speak. And then in 1996, they made another incredibly significant move. They acquired Pyxis Corporation for a cool $867 million.
This was a real game changer, wasn't it?
It was Pyxis specialized in those automated dispensing cabinets for hospitals. You know, the Pyxis MedStation units you see in medication rooms everywhere.
I think I've seen those, yeah.
So this acquisition pushed Cardinal into the world of medical technology. Now, they could offer hospitals not just the medications, but also the high-tech systems to manage and dispense them safely.
It was a pivotal moment.
Yeah,
they were evolving from a distributor into a healthcare technology player.
Absolutely. And those Pyxis machines had a real impact on healthcare. We heard from a nurse who said it made accessing medications so much faster and safer. It freed up more time for direct patient care.
And I think the Pyxis supply station units were another important innovation. They helped improve the accuracy of medication retrieval and inventory management.
Right, which ultimately reduces waste and the chance of errors. These technologies really cemented Cardinal's role as a true partner to hospitals.
They were on a roll. They acquired Owen Healthcare in 1997, a leading provider of pharmacy management services for hospitals.
So they were embedding themselves even deeper into the operations of hospital pharmacies.
And the revenue growth during this period was just phenomenal. They hit $1 billion in sales by 1991, and then by 1999, they were at a staggering $21 billion.
They were one of the fastest growing companies in the country, and they capped off the decade with a truly transformative acquisition. In February 1999, they bought Allegiance Healthcare for $5.4 billion.
Allegiance was a spin-off from Baxter International, right?
That's right. They were a major manufacturer and distributor of medical products. This deal created a $21 billion healthcare giant almost overnight.
So suddenly Cardinal had this enormous portfolio of medical and surgical products. Everything from gloves and gowns to complex fluid collection systems.
It really solidified their medical segment alongside their pharmaceutical segment. They were becoming a one-stop shop for hospitals.
We even have a quote from a hospital administrator from back then who said, "This really simplified their whole supply chain management process."
It makes sense. They could get everything they needed from a single trusted source.
So by the end of the 90s, Cardinal was in every aspect of patient care and consistently delivering impressive earnings growth. And Robert Walter summed up their philosophy perfectly. He said, "Our people understand that when we do our work well, caregivers can focus their attention on patients." were the ones behind the scenes doing important work.
I love that quote. They understood their role as enablers in the healthcare ecosystem.
Okay, so let's move into the 2000s. A new millennium, new opportunities, but also new challenges for Cardinal. They started this era with $25 billion in annual sales and operations, spanning 5 continents.
They were a global healthcare force.
Yeah.
And around the year 2000, they launched their corporate and e-commerce websites.
So they were embracing the digital world as well.
They were, but they also continued to expand their portfolio strategically. In 2001, they acquired Binley Western Industries, which further solidified their leadership position in pharmaceutical wholesaling.
And they made some big moves into specialty pharmaceuticals and nuclear pharmacy, right?
They did acquisitions like Syncor, for example, turned them into the largest chain of radio pharmacies in the nation.
And radiopharmaceuticals, that's a whole other level of complexity, isn't it?
Oh, yeah, those are used in time-sensitive diagnostic procedures like PT scans. Think about it. They're handling radioactive materials that have a very short shelf life. It's incredibly specialized.
It is. And this brought Cardinal even closer to patient care, especially in areas like medical imaging and cancer treatment.
Absolutely. But the 2000s also brought some leadership changes. Robert Walter stepped back from his leadership role in 2006. R. Kerry Clark became CEO.
And then George S. Barrett took over as chairman and CEO in 2008.
Right. And Barrett brought a new focus. One of his key initiatives was spinning off the clinical and medical products segment into a separate company called CareFusion in 2009.
CareFusion included some big names like Pyxis Eller's infusion pumps and ventilators from VSC's Healthcare. So they were kind of reversing that diversification strategy from the late 90s.
In a way, yeah. They realized that the distribution business and the medical technology manufacturing business, they had different needs and priorities. This allowed Cardinal to really hone in on what they did best, pharmaceutical and medical supply distribution.
Barrett also talked about the changing healthcare landscape, the aging population, and the need to deliver care across the continuum, not just in hospitals.
And this led to them investing more in serving non-hospital settings. They launched the outpatient care division in 2009.
But of course, this decade also saw the emergence of a major challenge, the opioid crisis. Cardinal, like other pharmaceutical distributors, came under scrutiny for their role in the distribution of these powerful painkillers.
It was a difficult time. In 2008, they even had their DEA licenses temporarily suspended at some of their distribution centers.
And they responded by implementing stricter anti-diversion controls to prevent the misuse of these drugs.
They had to adapt to this evolving landscape and try to strike a balance between ensuring access to necessary medications while also addressing the growing concerns about opioid abuse.
And all of this was happening against the backdrop of the Great Recession. So it was a turbulent time for everyone.
It was. But the healthcare sector, being as essential as it is, remained relatively stable. Barrett's emphasis on agility and adaptability really sums up Cardinal's journey through the 2000s. They navigated these complex challenges and laid the groundwork for the next phase of their evolution.
Which brings us to the 2010s, a decade focused on expanding Cardinal's reach in specialty pharmaceuticals, home healthcare, and international markets.
Yeah, they were really strategic about their growth. Specialty pharmaceuticals in particular became a big focus area. These are complex medications often used for things like cancer and autoimmune diseases.
And they made a significant move in 2010 when they acquired Healthcare Solutions Holding, which included oncology supply.
That was the foundation of Cardinal Health's Specialty Solutions division. They were recognizing the growing need for expertise in handling these specialized medications.
And then in 2013, they formed a joint venture with CVS Caremark to create Red Oak Sourcing.
That was a huge deal. It became the largest generic drug sourcing entity in the U.S.
And I imagine that had a major impact on the cost of generic medications, making them more affordable.
Oh, absolutely. By combining their purchasing power, they could negotiate much better prices for generic drugs. It was a win for patients and for the healthcare system as a whole.
And they made a bold move into home healthcare in 2013 with a $2.07 billion acquisition of AssuraMed.
AssuraMed included established brands like EdgePark Medical Supplies and Independence Medical, and this meant they could deliver supplies for chronic conditions directly to over 1 million patients in their homes.
This was a huge shift toward delivering care outside of traditional settings.
It was. And CEO George Barrett at the time talked about how this aligned with the aging population and the growing trend of consumer involvement in healthcare.
Think about the logistics of delivering things like Diabetes testing strips, ostomy bags, catheters, wound care supplies right to someone's door.
It's a massive undertaking, and Cardinal at home even handled the insurance billing for those supplies, taking a huge burden off patients.
They were really extending their reach into every aspect of patient care.
They were, and they also tried to expand globally, acquiring a majority stake in Yongyu in China in 2010. It quickly became a multi-billion-dollar part of their business.
But that expansion into China didn't quite go as planned, did it?
Yeah. It faced some challenges. Ultimately, in 2017, they decided to exit the Chinese distribution market. They sold their operations to Shanghai Pharma for $1.2 billion and refocused their efforts on North America.
It was a reminder that expanding internationally can be incredibly complex.
It is. But they continued to make strategic acquisitions in the U.S. Like in 2010, they bought Kinray, which boosted their presence in the independent pharmacy sector by about 40%.
So they were constantly adapting and evolving their strategy.
They were. And throughout this period, they kept emphasizing their commitment to serving patients across all healthcare settings. And that focus on empowering caregivers, that was always at the heart of their culture. But as the opioid epidemic worsened, they faced increasing scrutiny and legal challenges.
Chapter 6 really delves into that complex period. They continued to innovate and make acquisitions, but the opioid crisis cast a long shadow over everything.
It did. In 2015, they bought Cordis from Johnson & Johnson for almost $2 billion.
Yeah, it was a big move into the cardiology and endovascular device markets, right?
It was. But integrating Cordis proved to be harder than expected, and they ended up selling it in 2021.
But then in 2017, they made another major acquisition. They bought a portfolio of medical products from Medtronic for over $6 billion.
That was a huge boost to their medical segment. They became a major manufacturer of all those essential medical supplies.
But the opioid crisis was escalating, and Cardinal faced a $44 million settlement with the DEA in 2016 for failing to report suspicious orders of opioid medications.
And that was just the tip of the iceberg. States, counties, Native American tribes, they all filed lawsuits.
It culminated in that landmark $26 billion settlement in 2021 with Cardinal and other distributors and a manufacturer.
Cardinal's share of that settlement was $6.4 billion to be paid out over 18 years.
It was a reckoning for the industry, and it led to stricter monitoring and reporting requirements for distributors.
Internally, Cardinal doubled down on employee training and implemented more sophisticated tracking systems to try to prevent the diversion of controlled substances.
This is also a time of leadership transition. Mike Kaufman took over as CEO in 2018, succeeding George Barrett.
Kaufman focused on operational efficiency, rebuilding trust, and cutting costs. He also spoke publicly about their commitment to supporting their customers on the front lines of healthcare.
And despite these challenges, they didn't stop innovating. They opened the Fuse Innovation Center in 2019.
Fuse was all about developing new digital health solutions. They had a pilot project for an in-clinic oncology dispensing and inventory system that showed really promising results.
The pilot showed a four-fold improvement in staff efficiency and a 70% reduction in errors.
It was proof that they were committed to finding better, safer ways to deliver care.
So by the end of the 2010s, Cardinal was this massive company with over $130 billion in annual revenue. They were operating on thin margins, but they were still a vital part of the healthcare system. And then the pandemic hit.
It was a whole new level of challenge. 2020 was a year unlike any other.
Chapter 7 takes us into that unprecedented year and Cardinal's role on the front lines of the pandemic. The demand for medical supplies exploded overnight.
Their medical segment had to go into overdrive to secure PPE from all over the world. They were part of Project Airbridge, a government initiative to speed up the delivery of critical supplies.
And in April 2021, they got a major contract to manage a big chunk of the strategic national stockpile. 80,000 pallets of medical supplies.
CEO Mike Kaufman spoke at a White House briefing in March 2020, and he really emphasized their commitment to supporting healthcare workers. It was a time of unprecedented collaboration between the public and private sectors.
We even heard stories about Cardinal truck drivers making those overnight deliveries of masks and other essential gear.
They were working tirelessly to keep hospitals and clinics supplied. Their business surged due to the demand for PPE and medications used to treat COVID-19.
And they were instrumental in distributing those new antiviral medications, anesthetics, and of course the COVID-19 vaccines. They leveraged their cold chain network to make sure those temperature-sensitive products arrived safely.
They were a key partner in Operation Warp Speed, helping to get the Moderna and Johnson & Johnson vaccines out across the country.
There were some bumps along the way, of course, like the recall of some Cardinal Health branded surgical gowns due to manufacturing problems in China.
The pandemic really exposed the fragility of global supply chains, but overall, Cardinal's workforce showed incredible dedication during that time. A warehouse manager we spoke to put it perfectly. They said we're healthcare heroes too.
They were absolutely essential. And despite the financial ups and downs of that period, the pandemic really underscored just how vital Cardinal is to the healthcare system. It also led them to make some important changes. They invested in domestic partnerships for PPE manufacturing and increased their safety stock levels for those critical supplies.
They were learning from the experience and preparing for the future. They also ramped up their investments in inventory management technology and data analytics.
It was a stress test for their entire operation, but they came through it stronger.
For sure. So for Chapter 8, we wanted to shift gears a bit and look at the real-world impact of Cardinal Health. Through some case studies, we can see how their work touches the lives of patients and healthcare providers in very tangible ways.
I like that approach. It's about bringing it down to the human level.
Exactly. So let's start with Northwestern Medicine. They implemented Cardinal's Wavemark RFID-based inventory management system in 37 of their surgical and procedural departments across 11 hospitals in 2024.
And the results were impressive, right?
They were. They saw a 78% reduction in expired products, a 50% reduction in supply waste, and an 11% decrease in on-hand inventory. That's a huge win for efficiency and cost saving.
Absolutely. And the supply chain manager there talked about how it improved their operations and increased trust among the staff.
They knew they could rely on the system to have the supplies they needed when they needed them.
Then there's the story of Maria, a 68-year-old retiree in Arizona who manages both diabetes and hypertension. She gets her essential medical supplies delivered to her home every month by Cardinal Health at Home.
It's a great example of how they're bringing care directly to patients. They coordinate with her endocrinologist, and they even handle the insurance billing.
It makes managing her chronic conditions so much easier. And Cardinal Health at Home serves over 1 million patients like Maria. Everything from ostomy bags to oxygen equipment.
It's an amazing service. And then there's the case of John, who needs a PET scan. This highlights the crucial role of Cardinal's radiopharmacy network, which is the largest in the country.
They prepare and deliver that radioactive tracer called FDG that's needed for the PET scan.
And it's incredibly time-sensitive. The nuclear medicine physician we spoke to really emphasized how much they rely on Cardinal for those precise and timely deliveries. It's essential for accurate diagnoses and personalized treatment plans.
Most people don't even think about that part of healthcare, but it's so important. And finally, we have the story of Community Hospital of the Valley, a smaller rural hospital with about 50 beds. They decided to outsource their inpatient pharmacy management to Cardinal Health.
It's a great example of how Cardinal can bring their expertise and resources to smaller hospitals. They helped Community Hospital reduce medication errors, improve inventory control, and boost patient satisfaction.
There's even a mention of a patient whose heart medication was always available thanks to Cardinal's management.
That's what it's all about, right? Making sure patients get the care they need when they need it. And the CEO of the hospital talked about how it brought big hospital expertise to their community.
Cardinal also supports 340B drug programs, which help safety net hospitals serve vulnerable populations. And they offer telepharmacy services too.
So they're really trying to expand access to care in underserved communities.
And what ties all these stories together is that Cardinal Health is working behind the scenes in all these different settings to make healthcare work. One of their executives said it best. They said their success is when doctors and patients don't even have to worry about whether the supplies will be there.
It's all about enabling others to focus on what they do best, providing care.
Okay, so now let's look ahead to the future. Chapter 9 explores how Cardinal is innovating with technology and logistics to stay ahead of the curve.
They're not resting on their laurels, that's for sure. Their 2022 acquisition of ScaleMed and its smart prescription management app is a perfect example of that.
That's a move into the digital health space, right?
It is. The app helps improve medication adherence and patient engagement. And Cardinal envisions a future where prescriptions are routed in the most efficient way possible.
So using technology to optimize every step of the process.
Exactly. And they're investing heavily in predictive analytics to anticipate drug shortages and demand surges. They're using AI and machine learning in their distribution centers and even exploring applications in clinical settings.
Like analyzing purchasing patterns to improve efficiency.
That's right. And CEO Jason Haller, who took over in 2022, has said he sees huge growth opportunities in AI.
It's clear they see technology as a key driver of innovation.
Absolutely. And then there's their venture into drone delivery. In 2023, they partnered with Zipline to start testing long-range drone deliveries to pharmacies and clinics in North Carolina.
Drones delivering medical supplies. That sounds futuristic.
It does. But it could be revolutionary, especially for rural areas. Imagine a drone delivering urgently needed medications or rare blood products.
And these aren't those little quadcopter drones. They're fixed-wing drones with sophisticated launch navigation and parachute delivery systems.
It's pretty amazing technology. And they're looking even further ahead. They're focusing on the future of specialty pharmaceuticals, particularly those complex cell and gene therapies.
Those are really at the cutting edge of medicine.
They are. And Cardinal is also expanding their advisory services to help hospitals reduce costs. They have a service called OptiFreight, which optimizes logistics and transportation.
So they're not just a supplier anymore, they're a strategic partner.
That's the direction they're heading. And their tagline, Essential to Care, really sums up their mission.
It does. And who knows, maybe in the future we'll see them integrating with hospital EHR systems or playing a role in public health emergency response.
The possibilities are endless, and they're starting to address sustainability too, which is so important.
So, to wrap up our deep dive into Cardinal Health, it's clear they've come a long way from those humble beginnings as a food distributor in Ohio. They're a global healthcare powerhouse, but they're still striving to maintain that innovative spirit of their founder, Robert Walter.
He had a great quote, "Distribution isn't rocket science, but you have to do it well and stay close to your customer."
That's such a simple but profound statement, and it's as true today as it was back then.
It is. It reminds us that even in the age of advanced technology, the fundamentals of good business never go out of style.
So we've seen how Cardinal Health has evolved over the decades. It's a story of adaptability, innovation, and a deep commitment to their role in healthcare.
They're often behind the scenes, but their impact is enormous. They ensure the medications we get at the pharmacy are available. They provide the supplies for surgeries. They get those lab tests to where they need to go.
We've been shaped by visionary leaders and dedicated employees. And they're a company that pharmacists, doctors, and all of us as patients rely on every day.
And their ongoing investments in digital health and drone technology show that they're determined to shape the future of healthcare.
They have the potential to make a real difference in areas like precision medicine and public health.
And they've never lost sight of their core purpose, solving distribution problems to enable everyone else in healthcare to succeed.
Their motto, "We'll get it there for you," says it all. And George Barrett summed it up beautifully. He said, "Cardinal Health people understand why we're here, so that caregivers can focus on patients, and we're the ones behind the scenes doing important work."
They're the unsung heroes of healthcare.
So here's something to think about after our deep dive today. We've explored this vast and complex network that supports our healthcare system. But what other invisible systems are essential to our daily lives and well-being?
That's a great question to ponder.
Take a moment to consider all the logistics that make our world work. It's truly fascinating when you start to think about it.